to welcome you back to the program today. And again, we welcome back to our program Dr. Gerayli from Spinal Pain Specialist Medical Corporation. Doctor, welcome back.
Thank you for having me again, Rob.
Good to have you with us.
Thank you.
We've always, in the past, talked about a variety of pains and primarily related to our backs and spines and that kind of thing. Today, it's a different type of pain you're talking about, but it is something that affects a lot of Americans. We know that there's a lot of cases of diabetes these days, and what you're talking about is something called diabetic neuropathy. Can you give us a sort of a layman's definition of that?
Absolutely. Thank you for having me. We've talked a lot about spine in the past, and diabetic peripheral neuropathy is a painful condition that affects the small nerves in the body. The reason diabetics get that is primarily because of the effect of the high blood sugar on the peripheral nerves, which occurs over many, many years, and it can be a very painful condition. Diabetes, as you know, affects multiple organs in the body. It's not just the pain that patients experience, but the GI tract can be affected. People can have nausea and vomiting because of it, constipation, sometimes diarrhea. In the periphery, numbness and tingling, poor balance, things of that nature can occur with diabetes when it affects the nerves. One of the conditions that affects our male population is impotence, and that's very common. And now with some of the medications, obviously, that has been treated. When it comes to pain and how diabetes can affect pain, typically the peripheral nerves in our hands and feet start to get affected. We start to lose sensation, and as these nerves start to repair themselves, they can become very irritated. Patients experience a burning sensation in their hands and feet. They develop a condition called stocking glove distribution of numbness, where your hands and feet go numb. And that has led to a lot of complications in diabetes, where if you don't feel your feet, you can bump your foot against something, have a small wound, and without sensation, you don't feel it, and that wound can get infected and have other complications.
So it really is, it's not so much the condition itself, but what it can cause. The numbness can cause other injuries and more serious injuries.
Absolutely. And in addition to the injuries, obviously pain is something that we see most of the time. By virtue of our practice, we see patients who present with a lot of burning sensation in their feet at night. They can't sleep. They get severe, sharp pains that are primarily in the feet, not so much in the hands, but it can also affect the hands.
And what you're telling us is that these are those nerves trying to regenerate themselves.
Well, they try, however, it's a progressive illness. There's really no cure for it. What you can do is really try and limit the symptoms by controlling the blood sugar as best as you can.
Controlling the diabetes.
Controlling diabetes is really key.
If somebody is having these sensations, though, and that would be pretty much the symptoms that would be letting you and other doctors know that this is what they're suffering from. So it's really impossible to cure it. But diagnosis would be what? Stick pins in their feet to see if it hurts?
Primarily, a good physical examination is really key. Obviously, the diagnosis of diabetes is made by various blood tests. However, when it comes to peripheral neuropathy, I think a lot of patients are underdiagnosed or diagnosed later than they should have been, primarily because they don't think about it until it becomes really painful.
Well, really, the family doctor and the endocrinologist is mostly trying to control the blood sugar. Maybe they need medication, maybe insulin, certainly diet and exercise to control the diabetes. The peripheral parts, like you said, gets treated maybe last or late in the game. And you're saying people should get that taken care of early on. Not curable, but what are some of the treatment modalities you can do to assist in that?
Once we diagnose the patient with peripheral neuropathy, let's say a patient presents with a burning sensation in their feet, and based on their history, you have made the diagnosis, and sometimes you can confirm that diagnosis by nerve conduction studies where our neurologic colleagues come into the picture and they do some testing of the nerves. Well, once you've made the diagnosis, there are several medications that can help reduce the irritability of the nerve, help reduce the sharp sensation that patients feel. There are some antidepressants, anticonvulsant medications, and some strict pain medications that have specific properties that help with nerve pain. So the goal is really to reduce the irritability of the nerves, control the pain without causing major side effects in conjunction with what the primary care physicians are doing with the control of the diabetes and the blood sugar itself.
Right. It sounds like something that really people that are diagnosed with diabetes need to think about, you know, and especially the fact they can injure themselves and not realize they've injured themselves, which can lead, like you said, to infection, and I guess sometimes even amputation if it's not treated properly.
Absolutely. And aside from pain medications, there are a variety of topical compounds that are now available that we use for diabetic peripheral neuropathy, where the foot or the area of pain can be covered. There are capsaicin creams, lidocaine patches, and things of that nature alongside the medications. Ultimately, when patients fail all these treatments, and there are a few patients who develop such severe diabetic neuropathy where the pain is so severe that it really interferes with their normal daily activities, and if medications have failed and all these other modalities have failed, that's when treatments such as spinal cord stimulation and things like that that we've previously talked about come into the picture.
And we've talked about that primarily for back pain, but what you would do is you would isolate the nerves going to the feet and put the procedure on that.
Exactly, and that's very, very effective for patients who have failed, obviously, all the conservative treatments, all the medication treatments. Isolating the nerves that go to the feet and stimulating those at the spinal cord level is something that spinal cord stimulation can do very effectively.
Right. So if somebody has been diagnosed either by their primary care physician or more than likely probably sent to an endocrinologist who specializes in these things, know they have diabetes, they want to be very, very careful with their feet and their hands as well, but take care. I know they want to inspect them periodically and maybe be even a little more proactive with, you know, cleanliness and all of that. But if they start getting that tingling sensation, that's the first signs, I guess, of this neuropathy problem. So they should get in to see somebody and deal with that right away.
Yes, and they can get started on some of the medications early on to slow down the process. Like I said, you can't really prevent it from happening, but you can certainly treat the symptoms and slow it down. Lessen the effects.
That's great.
Right.
And of course, you folks deal with a variety of other types of pains as well. We've talked about the spinal ones and other things, but if folks are experiencing pain from a variety of things, that's where your department comes in, helps them out. Again, that spinal pain specialist, Medical Corp, right here in our local community. Dr. Gerayli, thank you for coming by today. Good to have you with us on the show.
Thanks for having me.
Again, if you're suffering from either that or other types of pain, you can check it out and give them a call and find out more about the good services that they have to offer over there. We'll be back with more right after this timeout. Stay with us.
Exciting news for people in pain. Spinal Pain Specialist presents Living to the Fullest Without Pain.
Do you or someone you know suffer from some sort of bodily pain? Are you just living with the pain and don't know how to get help? At the pain management facilities operated by Spinal Pain Specialist Medical Corporation, you'll be able to have your pain condition accurately diagnosed and treated. The physicians at Spinal Pain Specialists make getting relief safe, easy, and comfortable by offering multiple solutions to whatever pain you may be experiencing. The treatment you need is now available. Treatments offered at Spinal Pain Specialists are powerful and effective.
For a comprehensive evaluation and non-surgical treatments for your back or neck pain, please contact Spinal Pain Specialist Medical Corporation so you can begin living your life to the fullest without pain.